Hello, this is Ariella Carmel, and we're in Paris as part of Israel's business delegation led by Kalkalist and Bank Hapoalim, and I'm here with Dr. Mark Lobenberg, head of shoulder and elbow service at Beilinson Hospital. Thank you for joining me.
It's a pleasure to be here.
So, we're meeting here in Paris shortly before the Summer Olympics. As a specialist in athletic injuries, can you tell me a bit about your work with elite athletes?
Sure. It's very, very different taking care of elite athletes because to be an elite athlete, you need obviously a certain skill set. You need to work on strength, endurance, and yet at the same time, you need to be focused on both injury prevention and injury rehabilitation. And for elite athletes, they don't really have the time to take to rehab in the regular manner that the everyday hobby athlete or non-athlete has to recover from their injuries. And so there's a lot of stress when you take care of elite athletes. And that stress is coming from the fact that they just don't have their long-term health as a concern, but their ability to return to the field of play and compete as soon and as quickly as possible. So what we have to look for in these patients is quick diagnosis and early intervention so that we can rehab these patients as fast as possible. And that means that we have to think out of the box and try to manage their care in a way that gets them back as fast as possible. For the general population, that's good because once you develop those techniques, we're able to bring that into the general population and then utilize that to get their rehabilitation going as quickly as possible as well.
Interesting. Now, you're also an expert in orthopedics. Can you talk a little bit about innovation in that domain right now?
Sure. Orthopedics is exploding in innovation now in a variety of different ways. One good example is robotic interventions. So for both spine surgery and hip replacement surgeries and knee replacement surgeries, and even in the shoulder, we're able to use robots and navigation to minimize the amount of surgical intervention that we take so that we can make our incisions smaller and our cuts more accurate so that the implants that we put in are much more anatomic for the patients. And in elite athletes, for example, we're seeing patients come back after hip replacements, even to play at the highest levels of tennis and professional hockey, for example, things which we thought were just unheard of in the past, but now are becoming more and more routine in our expectations.
And what about the impact of AI or augmented reality?
So augmented reality and artificial intelligence both playing a role now in orthopedics in different ways. Artificial intelligence is helping us with big data. It's helping us understand how to collate that information and look at correlations with our patient data on a global or national level so that we can understand relationships between problems and solutions in ways that we didn't before. So on a macro level, it's very helpful for us. On a micro level, that's where the augmented reality comes in. In other words, where we're able to deal very specifically with individual patients. So in the past, if you think about it, as surgeons, we're limited by our approach. So when I'm trying to replace a shoulder, I can only look at the shoulder from the front. And I have to look at all the imaging and keep in my head a three-dimensional understanding of what I'm doing. But now augmented reality is letting us, through the use of special glasses, overlay the 3D images from the CT scans and the MRIs so that we can be looking at the patient from our own perspective, but still have the three-dimensional image in front of us. And that, again, allows us a lot more exactitude in the way that we're undertaking these operations.
You know, it's quite a game changer. And what about the role of telemedicine? There's been a real rise in the post-COVID era. How does that impact this domain?
So COVID was a time when patients couldn't get to us, and yet we still needed to take care of them because they were injured. And as a result, what we started to do was develop techniques that allowed us to examine the patient essentially in a virtual way. Because if you think about it, orthopedic surgeons, part of our expertise is hands-on. We take the patients, we examine them, we push in certain places, we pull in certain places, we try to get an understanding of what the injuries are. And when you can't touch the patient, you're at a certain amount of loss. But what happened in COVID, just as a necessity, was that we developed certain techniques and tests that allowed the patients to perform these studies, essentially these tests on themselves, and then we could use those results to try to understand what their problem is. What's interesting is that once you do that, that allows you a lot more understanding and a lot more access, essentially. So with elite athletes, for example, what we're able to do is through teleconferencing, be able to be at with the athletes at their point of injury, wherever they are, and through these tests, try to understand what their injuries are and give them the advice and the diagnosis, whether or not they continue, whether or not we need other interventions, but to get to those interventions as early as possible so that they can get back to play as quickly as possible.
So you were previously a physician for the New York Mets. Can you tell me a little bit about how that experience impacted your work today?
Sure. So what you learn mostly from taking care of athletes who are really highly paid and with a tremendous amount of responsibility to their team and to their communities, what you learn is that the way that or the urgency that you take care of patients needs to be even higher in these athletes. And you take that experience and you're able to translate it to elite athletes and to Olympic athletes as well. For example, recently we had an Olympic level judo athlete. We're able to understand his injury very quickly by using ultrasound techniques to look specifically at where his injury is. And then we can, at the same time, in real time, begin to treat that injury by using the ultrasound to direct very specific biological medications where we're able to take the patient's own blood and concentrate it and then re-inject it into the area to advance the healing process for the patient and get them back as fast as possible to their intentions, which is to compete as fast as possible at the highest levels.
Okay, well, that's all the time we have for now, but thank you so much for joining me.
It's a pleasure to be here.